Hello, thanks for joining me at the PBM and Tinnitus Lab channel. I'm Dr. Katoyun Montazeri, and in this video, I want to explain about a disorder that is closely related to tinnitus, hyperacusis, and also the potentials of PBM in treatment of it. I emphasize the potentials of PBM. This is the 11th session of the PBM and tinnitus series. At first, let's take a look at a case of hyperacusis. Susan, who is a 34 years old high school teacher, she presented with a debilitating sensitivity to everyday sounds that are well tolerated by the normal hearing people. And she described certain noises as physically painful and stabbing. In her history, it was an exposure to a sudden loud feedback screech from a microphone when she was at school, and about 6 months ago. Since then, her tolerance for sound has decreased. Her symptoms were acoustic shock, means sounds feel unbearably loud for her, and phonophobia, means the fear of unpredictable sounds, and also social isolation. She stopped teaching and she avoids family gathering because she is scared of unpredictable exposure to sounds. Her tests, including pure tone audiometry, which showed a normal hearing threshold, but loudness discomfort levels test, or LDL, I will talk about it later, test showed a 45 to 50 decibel across all frequencies, although in normal person it is about 90 to 100 decibel. So her assessment was showed me her diagnosis was loudness hyperacusis and a secondary misophonia. Misophonia is a kind of emotional reaction to sound. I will talk about it later. And chronic high gain or sensitivity in auditory system leads to over-amplifying hearing neural signals in the brain. So Lisa was diagnosed by, Susan was diagnosed by hyperacusis. But what is hyperacusis? It refers to abnormal, exaggerated, painful sensitivity to everyday sounds that are well tolerated by people with normal hearing. There are four main kinds of hyperacusis. Loudness hyperacusis, in which sounds are perceived as much louder, for example, a whisper feeling as like a shout, and annoyance hyperacusis, in which there is extreme irritation, tension, or rage when hearing specific sounds. It overlaps with misophonia, but there is a difference between the two. Annoyance hyperacusis is kind of physical oversensitivity to volume or loudness of any sound. But in misophonia, there is an intense emotional reaction to specific trigger sounds regardless of their volume. For example, the sound of chewing gum or tapping. But they have an overlap. Another kind is a fear hyperacusis or phonophobia, in which there is an anticipatory anxiety or fear of hearing sounds leading to social isolation, and also pain hyperacusis, in which there is a physical pain, bumping or stabbing sensation in the ears at low or moderate decibel levels that are well tolerated for people with normal hearing. The causes and risk factors of hyperacusis. At first, acoustic trauma and noise. There is two kinds of acoustic trauma. Exposure to a sudden, loud, very loud sound like explosion, and also exposing for a long time to loud sounds. These two refer to acoustic trauma, and also hearing loss and tinnitus, head and neck injuries, concussions, whiplash accident, and also TM joint or temporomandibular joint dysfunctions, Bell's palsy. Bell's palsy is a sudden temporary weakness or paralysis of the muscles of the one side of the face caused by the compression or inflammation of the facial nerve, and it can cause the weakness of the stapedius muscle in the middle ear. And Lyme disease, which is a bacterial infection and transmitted by a black-legged tick, and there is a kind of neurological inflammation and involvement in this disease, and can lead to hyperacusis, and also migraines and migraine headaches. Migraine headaches is very common in tinnitus and hyperacusis, because there's a central and general sensory hypersensitivity in migraine. And some developmental disorders like autism and some other rare genetic disorders, and ototoxic medications like high doses of sodium salicylate which is in aspirin, and also some kind of antibiotics like aminoglycosides. I talked about the ototoxic medications in the triggers series. One full video was published there. But the common behavioral signs in hyperacusis included constant use of ear protection, including plugs or muffs, even in quiet environments, and avoidance of public places like restaurants and traffic and theaters, and also oral fullness, which is a feeling of pressure in the ears. The main diagnostic test is loudness discomfort levels test, or LDLs. It measures the lowest intensity of sound that a person perceives as uncomfortably loud or intolerable, and in healthy patient it is about 90 to 100 decibel, but in hyperacusis it may fall to 70 to 80 decibels, and even in severe cases as low as 40 to 50 decibel. Means that the normal conversation can be painful for these patients. But what is the link between tinnitus and hyperacusis? About 80 to 90% of hyperacusis cases also have tinnitus. And in 30% of tinnitus patients, there is also some degree of hyperacusis. So they share the etiology and comorbidity. And the central gain theory is for both in conditions, means that increasing neural sensitivity or gain due to loss of input leads to perception of tinnitus, and also it can cause external everyday sounds to be perceived as loud or painful in hyperacusis. There are maladaptive plastic changes in both conditions. Functional brain reorganization due to loss of input leads to spontaneous hyperactivity in tinnitus and an exaggerated response to sensory input in hyperacusis. And limbic and autonomic system are involved in both conditions and trigger a fight or flight response leading to anxiety, phonophobia, and sleep disturbances. I talked about the anxiety and depression and sleep disturbances in tinnitus in the triggers series. You can watch the full videos there. The established clinical treatments are cognitive behavioral therapy or CBT, focuses on reducing fear avoidance behaviors and change the patient's emotional reaction to sound. And tinnitus retraining therapy, which is a kind of sound enrichment using noise generators to gradually increase LDLs, helping the brain recalibrate its volume control. But what are the potentials of PBM or photobiomodulation in hyperacusis? I talked about the mechanisms of PBM in 12 full videos in the PBM masterclass. You can find them in the PBM masterclass playlist. And in a brief, there is a mitochondrial stimulation by using PBM, which leads to producing more ATP, which is the main source of brain and body's energy. And PBM has the ability to control inflammation and oxidative stress and reduces central gain, and it can modulate maladaptive plastic changes. There are full video about this. And it can stabilize neural signals and modulate brain neural oscillations. These are the references of this video. There are references about the definition and manifestations of hyperacusis and also central gain theory in tinnitus and hyperacusis and the mechanisms of them, and also the effects of PBM for the inner ear disorders. And there is also a reference about using PBM in pain threshold improvement for pain suffering from tinnitus and hyperacusis, and also laser therapy for subjective tinnitus. In this study focuses on the effects of PBM on neural gain and neural sensitivity in brain, and can be related to hyperacusis as well. The next video will be about the somatic tinnitus, which is very common. And please, if the video was useful for you, please subscribe the channel and suggest the channel to the other people. Thanks for your attention, and stay tuned.